feeding and what could be wrong with it?
So what we mean by mixed feeding is when a mother decides to breastfeed, they can either choose to feed their infant. Should they breastfeed or should they use formula feed or bottle feed? And the literature goes around saying that you should choose one or the other. So you should either exclusively breastfeed or you should exclusively bottle feed, but you shouldn't mix the two because then you won't get the maximum benefit of both. And by that I mean is if you breastfeed, then you get the maximum benefit of the antibodies that a mother has then to pass on to their infant. And then if you decide to bottle feed, then all circumstances should be correct, and we can talk a bit about what that means. But if you start mixing the two, then you don't get the maximum benefits. So you don't get the full antibodies from the mother, but you're also going to get the potential harmful side effects if you don't do bottle feeding correctly. So really, you've got to choose one or the other and go with that.
But in this case, we are talking about HIV-positive mothers. So what are the chances that, should the mother choose to breastfeed exclusively, that they could infect the child?
Right. So when it comes to HIV, it's not such a simple answer about what you should do. Yes. So the answer is if you breastfeed exclusively, there is a risk of obviously the baby actually catching HIV. And in fact, it's around 10 to 15% risk without the mother being on treatment. If the mother takes the correct antiretroviral treatment, which they should be given if they've gone through the correct antenatal process, that risk can reduce to less than 1%. But there is obviously still that small risk, right? However, if the mother then chooses not to breastfeed but exclusively bottle feed, then and use formula replacement feeding, there's no risk of the virus passing through, but there's still the risk if the mother lives in a low socioeconomic circumstance, from poorer communities. Are they using the correct formula? Are they mixing up the formula feeds correctly? You know, is there contamination in the water, which can also cause about 15% of deaths that we see throughout Africa.
And when did all this change? Because not so long ago, mothers were advised to not even dare breastfeed their children and rather look for more safer options to breastfeed, to rather bottle feed or feed their babies. What happened? The evolution of information perhaps happened then?
Well, that's right. Well, it's been recognised certainly over the last couple of years that breastfeeding is a very healthy way to actually feed your baby. As I said, there are a lot of antibodies. So the question here, you've got an HIV mother, and the HIV mother says, what should they do? So that's really, firstly, they should go through the correct antenatal process. If they're found to be HIV positive, they should actually go into antiretroviral therapy. Then it depends on, can they actually, if they're from a higher socioeconomic group, which means can they access the correct formula feeding? Can it be mixed correctly? Can they give it in a healthy way to their child? If that's fine, then obviously formula feed is a good option. If the mother doesn't have those options, they don't have access to the correct nutrient feeding, the correct bottle feeds, the correct sanitation, then the mother, the guidelines, and this ties in with the World Health Organization guidelines, they should breastfeed. They should breastfeed exclusively, not mix it with bottle feeding, because that will introduce all the contamination, and go through the correct antenatal process and take the correct antiretrovirals, and that will decrease the risk to less than 1% that their baby would actually get HIV.
Doctor, how would you then advise mothers or HIV positive mothers in this regard who have the stigma attached that, you know, bottle feeding make you less of a mother, and, you know, breastfeeding makes you enough of a more of a native mother? But how would you advise them to, you know, act against that stigma that's attached to them, as opposed to an HIV positive mother who is breastfeeding regardless?
Yes. So there is a stigma around that, and really we've got to rely on education. It's got to be education in the antenatal clinics, education actually through the healthcare programs throughout South Africa, but that actually for some women breastfeeding is okay, and for some women it's not. And it's not just an HIV thing. There are circumstances, as we said, that it may not be appropriate, and there needs to be education through the masses and enlighten mothers that it's okay to choose either one as long as you stick with that one.
Absolutely. Now, we also know that the baby, of course, will obviously grow and teeth, and we know that that's a very sensitive period for mothers because that's when they bite the mother's nipple. But what are the options then for the mother in that period when the baby's teething?
Right. So what goes again, if the mother has chosen to breastfeed, then obviously it could be painful during a particular period to carry on with direct breastfeeding. So we would really encourage the mother there to express as best as she can and then you're still getting the breast milk, but you're not perhaps giving it actively via the breast. And so express milk is the option there. And then if the mother's still struggling or not, then they should actually consult the antenatal clinic. But I think the key message here is that actually in the antenatal process, before the mother has a baby, they should discuss with the various antenatal nurses and the midwives, etc., all these issues, and discuss which are the best options.
Now, you mentioned earlier about certain guidelines that HIV-positive mothers will need to follow. And for those who didn't actually quite get the guidelines, can you just briefly mention a few that, of course, regarding breastfeeding with HIV-positive mothers?
Okay, so once again, the World Health Organization suggests that everyone should that a mother should actually breastfeed, right? Breastfeeding is best, and that the mother needs to go to the antenatal clinics and, if necessary, go into the correct antiretroviral therapy to decrease the risk. However, if the mother is actually in a higher socioeconomic status and can afford, they can discuss with their antenatal clinic about bottle or replacement feeding, but then it needs to be sure that it's done in the correct way, that it doesn't put the baby at risk for other types of diseases.
All right, Doctor, we've run out of time, but your website, please, at AllLife, in case
it's
we all want to get
alllife.co.za.
information.
AllLife.co.za.
All right. Dr. Avron Urison, thank you so much for joining us and sharing that important information with us here on A News.
Super. Thanks very much.
Thank you so much. All righty then. We'll